Hello everyone, hope you're all doing good. It's been a long time since I saw you, and today I have come up with the topic Polycystic Kidney Disease. So what is a polycystic kidney disease? It is a group of inherited disorder that usually occurs due to development of multiple cysts in and around the kidney. Generally, the polycystic kidney disease is of two types. The first one is autosomal dominant polycystic kidney disease, which is the most common, and it usually affects the kidney, and it is found usually in the young adults. The second type is autosomal recessive polycystic kidney disease, and it is not that often seen and usually occurs in the early phase of life and usually attacks the young infants, early phase of life in the infants, but it is not a very common one, so we need not go into detail in that one. So let's take along the autosomal dominant polycystic kidney disease. Why does it occur? This one occurs due to alterations in the mutation of the gene PKD1 and PKD2. If I tell in more detail about this gene, it will be more tedious. So let's just brush about what all happens in this disease and how do we manage this. So the most common, as I said, is the autosomal dominant polycystic kidney disease. It is usually found in a population of around 500 to 1000. In one among every 500 people is affected with this disease. And the clinical features usually comprises of, the first one is hypertension. The second one, more common, is hematuria. Hematuria is nothing but blood in the urine. And usually people will get a flank or abdomen pain. The first one is due to rupture of the cyst or even with the enlargement of the kidney. Like a normal kidney size is between 9 and 11 centimeters. But in people with cyst development, the kidney will extend to maximum about 15 to 20 centimeters even, completely replaced by cyst. Sometimes the cyst will get ruptured and it will also cause pain in the abdomen and also gives rise to hematuria. The fourth one is mild renal failure that goes on to develop severe renal failure, and people will end up with hemodialysis. The fifth one will be like people developing infections in the urine, urinary tract, or even cystitis. Now we see the extrarenal, which is the outside the kidney features. Like the cyst will also develop in liver, the cyst may also develop in the pancreas, and sometimes the liver will also be replaced with cysts, causing hepatomegaly. Okay, how do we find people with autosomal dominant polycystic, or for that matter only polycystic kidney disease? Okay, this disease runs in family. As said, it is a hereditary disease. So when you find someone with polycystic kidney disease, it is better to screen their family. So the familial screening will comprise of commonly an ultrasound of the abdomen or even an MRI or a CT scan. The second thing, you can do a urine test, a urine complete analysis, and a blood investigation comprising of the renal function test to see if they are having any renal abnormalities. How do we manage this problem? The treatment for autosomal polycystic kidney dominant disease is not yet completely known. Research is underway with treatment of tolvaptan has been proposed, but it is not known how far it is useful for the management. And for features comprising like hypertension, hematuria, the symptomatic treatment is best handled. For hypertension, the best usage of ARBs or ACE inhibitors for the reduction of proteinuria is proposed. For hematuria, first we have to see whether it is an infective episode or just the rupture of the cyst. And if the rupture of the cyst is the cause, then we have to manage the pain with some NSAIDs. And if it is a genuine UTI, we have to give some antibiotics for that case. To sum up everything, patient education with lifestyle modification will definitely reduce the number of hospitalizations for the symptomatic causes. Thank you. See you with other topics soon.